My name's Kristen. I'm a nurse, a charge nurse up on the medical unit at CRMC. Overall, caring for COVID patients, it's been kind of challenging and stressful at times. Sometimes these patients are very, very acute and we have to keep them on the floor for a longer bit of time. And it's been kind of difficult, kind of worrying about them and keeping them healthy and keeping a good eye on them before they get worse or potentially get worse. And it's also challenging just for us mentally and physically, emotionally. We're always wearing PPE. We're spending sometimes extended periods of time in the room, just depending on their acuity. And it just makes it difficult to kind of process the things that they're going through, plus the challenges of being a nurse for them. And I think the patients kind of find it challenging too, because we are spending sometimes a limited amount of time in their rooms, just to limit exposure and limit PPE. We've had a lot of patients, especially the really sick ones that come in on a lot of oxygen, that it's kind of heartbreaking, but they're just, they're saying they're sad and they're scared. They don't know what's going to happen. They're worried about their family if they were to die. And at that point, they're coming to us. They may not be to ICU level yet, but they're still very sick. And at that point, if that's what they're worried about, it's kind of heartbreaking that that's the first thought, is that they're going to die and their families are going to have to live without them. So that's kind of hard to hear. We try and give them as much positive thoughts as we can. We don't want to say, as much as you want to say everything is going to be okay, we've seen bad outcomes. And so it's hard to tell them that, because sometimes that it's not. Even patients that you send to the ICU, you want to tell them positive things, but there's, we've seen the negatives that come out of it. So it's hard to tell them, but I think trying to just tell them everything that's going on, give them not daily updates, but frequent updates, update their families for them so they don't have to worry about talking about the right things or telling their families something wrong, and then their families, are getting really frantic, worrying that something major is going on. We're trying to keep them connected to their families, whether it's through phone. We're using some video communications with some of them that request it. I think it's just more about giving them some positive thoughts and just encouraging them with every little milestone that we reach, whether it's a big one or a little one. I think just reinforcing that things are going well, but you are still sick and we're doing what we can to help make you better. It sounds kind of cliche, and they always say, that people become people in health quick care, whether they're MDs, nurses, any aspect of it, that they like taking care of people. And that's really what I like to do. And most, many of my coworkers would tell you the same thing, that they enjoy taking care of the patients, seeing them get better, building that rapport. And even though we're in the rooms for a limited amount of time, we sometimes have patients up on the floor for almost 4 weeks. And so we do get to build a rapport. I talk to patients on the phone just through rounding if I don't see them in person, and I, get to know them a little bit after 4 weeks because they've been here so long. So I think that kind of keeps coming back, and then seeing some of these people get better that have been here so long helps you want to keep coming back and get more of them better. And I think a lot of us decompress kind of in the same way, just doing self-care, relaxing at home, even if it means just laying on the couch and binging some Netflix or something, going for a run, going to the gym, anything that just kind of helps you get your mind off it and leave work at work right now, and know that the patients are in good hands with your coworkers. Really, I think that it's important for the community to know that this is actually serious. There's a lot of people who don't have symptoms and don't need to come to the hospital, but there's a lot of people, not only from Cheyenne, but from around the state, from around surrounding states, that have been here and have been very, very sick and have even unfortunately passed away from COVID. We're here and we're struggling kind of some days. We're working overtime, we're working long days. We're seeing very, very sick patients, which can be emotionally and mentally draining. So I think just as much as people don't like it, I think it's just important to help follow those guidelines. Wear your mask, limit your gatherings, and if you do feel like you need to gather with someone outside your household, to wear a mask, stay 6 feet apart, because we don't want to see you in the hospital in 2 weeks because you had to do those things. And unfortunately, some of these people do not have good outcomes, and we don't want that to be you. So it's kind of a hard thing for people to take, but it's also important that people realize that there's real people getting it and real people that are working with these patients, and it's not just something that's reported in the news.